I will show you now an EpiFlow tape for Epicondylitis lateralis. We also call it the tennis elbow, which is an insertion tendinopathy of the musculus extensor carpi radialis brevis, which gets created when there is lots of overuse of the extension muscles of the wrist, and misalignment, arthritis, and we try now to only do a tape for the insertion area. To look at where this muscle comes from, if we have a close look at the skeleton, the muscle comes from the lower part, from the distal part of the humerus, and goes over the elbow. So this is the area we want to tape, where we try to create space and an extra metabolism on the insertion of the extensor muscle.
Maybe I'm just going to go around.
Yes, perfect. So a comfortable position for the patient and a little bit of a loose pec position, so slightly flexed elbow. We're going to measure before again. So we make sure we go over the elbow joint, cut the tape, remove the middle backing paper, fold the tape double, remove, cut the corners off, remove the rest of the backing paper, which sometimes can be a little bit tricky without any fingernails. And then we tape over the elbow and over the insertion of the extensor carpi radialis brevis muscle. And now we don't grab completely at the end because we don't want to pull just the tape off. We grab the activation flap, lift, and then do our 5 standing circles clockwise and anti-clockwise along the activation ledge. And Anna or the patient will feel the areas which are most painful. And we can ask her again to quickly do it herself, to just feel.
And again, I think this is really the nice thing about the EpiFlow, that they can treat, the patients can treat themselves during the day, 3 times per day by themselves, having whenever they have the time to treat themselves. Doesn't really take long. And then they treat themselves maximum 5 days in a row, then they skip 2 days without a tape on the skin to let the skin recover and do their skincare, and then put a new tape on and again repeat the treatment.
Yes, and as well as we did it now on the Epicondylitis lateralis, we can use the same tape, the same idea of the tape on the medial side of the elbow. So this would be the golfer's elbow, now, where it's not the extensors of the wrist, but the flexors of the wrist. So you can just use the same tape idea on the insertions of the flexors.